Wonderful. Good afternoon, everyone. Welcome to Thursdays with Friends, an online chat conversation about current issues. This program is brought to you by Friends Committee on National Legislation, a national nonpartisan Quaker organization that lobbies Congress for peace, justice, and environmental stewardship. I'm the show's producer, Wesley Wolfbert-Pinkham. Here's our chat host for Thursdays with Friends, FCNL General Secretary Diane Randall, and our guest, José Santos Woss, Legislative Manager for Criminal Justice and Election Integrity on the topic. Love thy neighbor, people in prison.
Thank you, Wesley, and welcome to all of you who've joined us on this Zoom call. It's pretty encouraging and joyful to see people from all across the country, from Hawaii to North Carolina, Washington State, Ohio. So we're really happy that you've joined us today. Despite the hardships that so many are enduring right now during this pandemic, we have appreciated that we are able to make these connections virtually via Zoom and via various conference calls with folks that are part of the FCNL's network. So we thank you for joining us. And many of you have been long involved with FCNL as advocates, as donors, as people who served on FCNL's General Committee. And I just want to thank you for that service and for your financial contributions, because it makes a huge difference for our work. So thank you and welcome. I'm really pleased that José Santos Woss, who is the legislative manager for our work on addressing mass incarceration and election integrity, is here to talk today about the situation with regard to COVID-19 and prisons. Many of you know Jose from time that you may have met him at annual meeting or in his own travels on behalf of FCNL. Prior to joining us at FCNL, worked at our sister Quaker organization, American Friends Service Committee, as well as for Senator Menendez in the US Senate. He has a background also working with people with HIV in New York City. And we're really thrilled that he's here today. José's worked with the Interfaith Criminal Justice Coalition. He's been a co-chair of that organization. And I think many of you know that much of the work that FCNL does, we do in coalition with many others, and we're able to leverage our own leadership in those areas and also build more power. So José, welcome. Let me just let you say a few words.
Thank you. So I thought it would be helpful if we start off with some framing to give us some context to how the pandemic is affecting people who are in prisons. There are 2.2 million people incarcerated, both state and federal. 171,434 exactly as of today are incarcerated in the Federal Bureau of Prisons. The Bureau of Prison staff is 36,000 people. Since March 26th, we've seen 1,440 people be transferred to home confinement. 566 incarcerated people and 342 staff who have tested positive for COVID-19. 24 incarcerated people have died. The incarcerated are about 50% people of color, therefore there's a clear disparity in who this virus is affecting. 240 incarcerated people and 52 staff have recovered so far. And now, to give further framing to the issue, there's an ask that we're going to make of the next COVID response package that's going to be debated in Congress. The incarcerated are worthy of dignity. There's that of God in every single one of them. With that said, Bureau of Prison facilities should have access to sanitary conditions and healthcare to meet this crisis. Currently, it's impossible to follow CDC guidelines, and to that end, we should be releasing people to the full extent that we can, focusing on those over 50 or with medical conditions that put them at greater risk of contracting COVID-19. Lastly, bans on social safety net services like SNAP and TANF should be lifted so that the formerly incarcerated can seek support in a vulnerable time.
Thank you. And we're going to go back to those again before the end of the conversation, because we do have an ask of all of you who are participating in this call, a call to advocate with us as we look forward. You know, Jose, you've been working on this issue for a while, and I want to just go back to your statement about we believe that everyone is worthy of dignity. And for me, that equates to what we often think about, what we often name as friends, that there is that of God in every person. And I think particularly with this pandemic, the people who are in prison are sons and daughters, their fathers and mothers, and their brothers and sisters, and they are part of the human family. And obviously, there is some risk for anyone who is living in a confined space. So I'm wondering if you could say a little bit more about the conditions in federal prisons with regard to access to those mainstream ways that many of us are contending with this virus, which is to be able to wash our hands with soap and water, to be able to use sanitizer, and to be able to keep a 6-foot distance from other people.
Yes, so there are seemingly countless touch points in the anatomy of an incarceration. You start off with arrest, you move to jail for pretrial detention, trial, and sentencing in a courtroom, and ultimately incarceration. Probably the only part of that that's practicing social distancing is the courts, which have been operating online. At every point, people caught up in the criminal justice system risk heightened exposure to COVID-19. Even more concerning that the over 50 population is the fastest growing due to longer and longer prison sentences. Once incarcerated, people are especially vulnerable to COVID-19. For example, hand sanitizers is out of the question. It's contraband because it contains alcohol.
Mm-hmm.
Sanitary conditions are also so poor that hand washing is rare. And there's barely any room to get much space, let alone social distance. The average cell is 12 by 7 feet. And it's important to note that contracting COVID-19 isn't just one event. It takes into account your viral load as well. Because if you're in an environment that has a lot of COVID-19, you're probably gonna get it more than someone who just got a low touch of COVID-19. So that's why there's so much talk about this being such a serious crisis in prisons.
Mm-hmm. Well, and I want to note that clearly we're thinking about people who are incarcerated being confined to cells that don't always allow a 6 feet distancing, but it's also a risk for those who work in prisons too. And you named that there are a number of people who, as we look at the situation in prisons, it's a tinderbox in some ways for anyone who is in that situation. And so I think it's important to think about what has to happen to deconcentrate. And I want to talk, just if you could ask you to talk actually for a couple of minutes about what happened, what was put in what we're referring to as the CARES 3 package. That is the relief package that passed probably about 3 weeks ago by the House and Senate that had $2 trillion in it. We've all heard about the money going for small businesses, how the protection program ran out. We've heard about a bailout for airline industries. What was in there that addressed any kind of relief for prisons or tried to address this situation?
Congress appropriated $100 million to the Bureau of Prison staff for medical services and overtime. They also appropriated $850 million to local law enforcement and local prisons and jails in what's called the Burn Jag Memorial Justice Assistance Grant Program. And this can be used for personal protective equipment or PPE and sanitary conditions in jails and prisons, although the states are the ones who ultimately have the discretion. And lastly, there was, there was a provision that provided for free calling during the duration of the pandemic. And so that's what Congress included in CARES.
Okay. Jose, I just want to see, we're seeing a couple of messages where people are having a little bit of difficulty hearing you. Your microphone might be cutting in and out. So I just want to make sure that you're aware of that to speak into the microphone. And I also want to just pause right now to say that we are going to try to answer questions before this program ends. This is a 30-minute program. And if folks have questions, I think there's a variety of ways that they might be able to submit them. Wesley, can I ask you to come back on and just remind those listening or viewing how they can submit questions?
Yeah, absolutely. Thank you so much. There's many ways to submit your questions. I would recommend just whatever you're watching this on, whether you're tuning in from YouTube, from Zoom, or from Facebook, you can just pop into the chat, which is right next to you, and submit questions there. If you feel like sending an email, you can send an email to Stephen, Stephen, at fcnl.org, or Susan, which is Snavi, Snahvi, at fcnl.org.
Thanks, Leslie. Um, Jose, I know you may have seen that there's a question there. Jasmine out in Montana was asking us if you could repeat the name of the federal grants that went to states and municipalities.
So that specific federal grant that was allocated 850 million is called the Burn JAG Assistance Program.
And that's like an existing program that has distributed federal money to programs that are doing reentry and various forms of support for helping people as they is it primarily for reentry or
So it's primarily for law enforcement, but
Okay.
because that also includes corrections officers in state and local jails and prisons, it provides for some assistance there.
Okay, great.
And then just one point that I forgot to
Yeah.
make that was included in CARES is more home confinement and compassionate release, which unfortunately the BOP and the Department of Justice have been really conservative and have not been fully utilizing.
Well, say a little bit more about that. BOP being bureaus of prisons and the Department of Justice have set up guidelines, right, for who's eligible for home confinement and who might be eligible for early release. Could you talk a little bit about that? Because I do know that there's also been actually some research about older people who receive early release and sort of, you know, that's actually a pretty important policy effort, not just to reduce this issue of closeness, you know, and of proximity during COVID, but it's actually a very compassionate way to address the needs of older people who have been incarcerated.
Yeah, so there's a provision that allows for if someone's very old or infirm or has late stage cancer or needs a respirator or just has medical conditions that make it more difficult to be incarcerated, they can be let out. Home confinement is a alternative to being incarcerated in a state local prisoner jail or a federal prisoner jail as well.
Okay, that's good. Let's turn for a minute and talk a little bit about the issue once for people who are released, because one of the, you know, if those of you who joined us 2 weeks ago when I was chatting with Amelia Keegan about the work we're doing and advocating for more SNAP benefits and for other benefits for people who are highly vulnerable, we certainly are hearing that certainly for people who have lost jobs, who have become unemployed, people who are low income, you know, are suffering at an even higher level, and disproportionately people of color are suffering at a higher level, dying of this disease. We know that the needs that the pandemic is causing go beyond even the time we're in, the time when we're seeing these peaks of infection, and there will be longer term needs that people who are low income will have. Can you talk about some of the unique needs that people leaving prisons have as they try to re-enter society?
So in a very good market, you see about a 27% unemployment rate for the formerly incarcerated. In the first year, you see a median salary of about $10,000. So the challenges are pretty stark. They're very, very serious challenges to reentry. If you have a drug felony conviction, you can access SNAP or TANF in some states. Depends on the state. And you have to face the box. You have to check off the box that says whether or not you've been incarcerated. So there are a lot of different challenges, and the two that I just mentioned with SNAP and TANF, those are called collateral consequences, and there are about a total of nearly 48,000 in the US that exists mainly at the state level. And this is just me talking about how things are without a pandemic, in a normal to good economy. So with this pandemic, it's much more serious to re-enter into this climate.
Yeah, talk a bit about that, because I mean, we talked before about the ability to get onto Medicaid and Medicare. And while that's, I mean, healthcare, we know there's huge structural problems in our country in terms of access to healthcare, but obviously Medicaid and Medicare are essential for people who are low income and essential for people who may be suffering from COVID-19. How do people leaving prisons get access to Medicaid and Medicare?
So there's something that's called the inmate exclusion provision, which cuts off your access to Medicare and Medicaid once you're incarcerated. And one of the asks that FCNL is putting forward as a part of what we hope to see in the next coronavirus response package is to allow for correctional administrators to switch on the light and open up access to Medicare and Medicaid 30 days before someone's released, so that once they get out at the point of reentry to the community, they don't have a gap in coverage.
Okay, that's very helpful. So again, just back to the top of what we talked about when you gave context about federal prisons versus state or prisons or local jails. One person responded on this that there are some real challenges at the state level. We don't at FCNL work on state policy. We really work on federal policy. But are you aware of any states that are particularly responding effectively at this time? You know, really right now in during this pandemic?
I think California is a good example. California's been pretty aggressive with their releases. They could be doing more. The need to have people transition to home confinement or just let out is pretty large. And if I could talk about the federal level, the Federal Bureau of Prison population is about 50 to 60,000 if you count the people who are either over 50 or have a vulnerable condition that makes them vulnerable to COVID-19. So there's a lot left to be desired in what we can see from the Bureau of Prisons with respect to releasing a large amount of people.
So you're saying that there are 50 to 60,000 of that almost 180,000, was it, in federal prisons that would fit the criteria for compassionate early release or under this new order that was part of CARES 3. Is that what I understood?
Yes, and including people who are over 50.
Okay, so that idea of being able to release that many certainly could go a long way to creating better conditions inside the prisons.
Yes.
At least the federal prisons, yeah. So Jose, let's talk a little bit about what people can do, because we clearly have a pretty strong encouragement for people to contact their own lawmakers. And I'm wondering if you could go back to the naming some of the issues that we want people to talk to them about, and then we can talk a little bit about how people can do that using FCNL's website, which has, I think, great resources for how to stay in contact with federal lawmakers, even during this time of social distancing. But could you go over the policy parts again, please?
Yeah, of course. So Congress needs to open access to Medicare and Medicaid 30 days before someone's released from prison. And like I said, this is because incarcerated people are banned from accessing Medicare and Medicaid while incarcerated and can produce a gap in coverage once they're released. We also need more congressional oversight. So just speaking about this with your member of Congress is really important because there's that important oversight role that Congress plays. Because we don't really know what the need is until the Bureau of Prisons says what the need is. And we know that the $100 million that was appropriated by Congress in the last package was not enough. We also need more generous use of home confinement and compassionate release. And just to repeat the number again, 50 to 60,000 people in BOP's custody meet the threshold of being either over 50 or having a medical condition that makes them vulnerable to COVID-19. So there's a lot more that we can do in terms of instituting mass releases to make those conditions better. And lastly, quarantine should not equal solitary confinement. It's torture.
Yes. Thank you for bringing that up. I mean, FCNL has a pretty strong position against solitary confinement, and many of our colleagues have worked on this issue. And I guess I just want to say, it's pretty horrifying to think that that's the resource that prisons have to quarantine people, given what solitary confinement the harm it can do in other ways.
Yeah.
So Stephen Donahoe has just posted on the chat where people can go to take action. And it is at fcnl.org /CJ Action for criminal justice action. And I want to give a shout out to Jose and my colleagues at FCNL who've really built out a great webpage about taking action right now in terms of not just emailing your member of Congress, but actually looking to arrange a telephone call, arrange a Zoom call. And I can also let you know that if you contact us, we can try to help you do that. If you have questions about how to do it, although I do think that the resources on FCNL's website are good. And to say that we are consistently updating those resources. Right now, like everyone else, the FCNL staff are working from our homes. So we're all calling you from where we live in our work offices and seeing each other in those conditions. But we've been able to carry out and implement our work quite effectively. And many of you know that we actually had a terrific spring lobby weekend with young adults about 3 weeks ago, including 130 virtual lobby visits that took place. So we are really grateful that we were able to do that and can continue to encourage grassroots folks from around the country to be in contact with their own members of Congress. So that's really a great idea. I see Jim Kaysen is encouraging everyone to find 3 friends and schedule a virtual lobby visit, which is a terrific idea. It's really nice to be able to do this in conjunction with colleagues. And if you're part of a Quaker meeting or part of some other faith group, or even if it's your family members who are willing to do this, we encourage you to set up those virtual lobby visits. So one question that came in, Jose, was someone, and this may be Jasmine still from Montana, looking for, how do you find out where the burn JAG grants went? Is that on the Department of Justice website if someone's trying to look at like what each state got out of that money that you talked about?
Yes, I believe you can find that on the BJS page of the Department of Justice. BJS, of course, stands for Bureau of Justice Statistics. So now that I'm saying that abbreviation, that doesn't sound right. Going through the Department of Justice website and searching for burn JAG, that should give you a report.
And isn't it spelled B-Y-R-N-E?
Yes, B-Y-R-N-E.
Yeah,
burn JAG.
Hyphen J-A-G.
Yes.
Yeah. Okay. Great. So someone asked this question. I'm not sure that I don't know the answer. You might. It says a state attorney defender office of Michigan, which is the website sado.org, has sample motions, including emergency motion for pretrial release due to public health and safety threat. Is there any way to do what Michigan is doing to take that on a more massive scale on a federal level? Are you aware of any kind of efforts around that?
So the main mechanisms at the federal level right now are home confinement or compassionate release, and they're being utilized very conservatively. So that's the only 2 tools that we have right now. And going back to the last question, our good friend Eric Sterling found the correct acronym. It's Bureau of Justice Assistance, BJA, Bureau of Justice Assistance.
Great, that's great. So I was just checking to see, people know that if you're following Congress, that the House is in session today, and they are, I don't think they voted yet, at least I didn't get a notice yet that they voted, but they are planning to vote on the bill that the Senate passed. And then at the same time, we know that we're expecting that sometime in May, maybe, I don't know exactly when, there will be yet another relief package going forward. And it's what we're referring to as the 4th release package, or CARES 2. And FCNL is pulling together a list of our requests that we will be sending to Congress, and we will be posting that on our website as well to share with everyone. But the items that Jose included here and has talked to people about will be part of that request that FCNL forwards, as well as some requests that Amelia talked about last week with regard to SNAP, to food benefits. And I just want to let people know that in 2 weeks on Thursdays with Friends, Carrie Colfer, who is the legislative advocate on Native American affairs here at FCNL, will be joining me and talking about what has happened for Native American populations in these relief bills, but what else does need to happen and what's the current state of affairs. So I just wanted to make sure people knew that was going to happen in another couple of weeks. Jose, anything else you want to say? We're kind of coming to, I think we just have a few minutes left. Any closing remarks you want to make, or do I have any other questions that people are asking? I feel like people are what we're seeing is people are putting up some additional resources in the chat box, which is terrific. Thank you so much for that. Steve Winfield, let me just ask, Steve Winfield asked questions about the Pell Grants. This is something we've been working on for a long time. Do you have anything to add on that?
Yes, so we were hoping to see some floor action over on the House side. Unfortunately, the pandemic took over and we haven't seen that floor action come to pass yet. Over on the Senate side, we were waiting on negotiations between Chairman Lamar Alexander and Ranking Member Patty Murray. Those negotiations, we don't know where they stand either because of the pandemic. So it's unfortunately stay tuned for right now.
Okay. Jose, I want to thank you. We have, Stephen is telling me that we have some great stories on the chat. And I guess this is a question for Wesley. Is the chat function available to people after this Zoom call ends? If people want to see the resources or the stories, William Monroe, I guess, put up a great story that I haven't read yet, and I'm hoping to look at it.
Great. Yeah. We typically do have that available. We haven't distributed that in the past, but if there's a demand for it, like it sounds like there is, we'll figure out a way to get that out to everybody.
Okay, and these have been recorded, correct? So these chats are recorded, so people can go back and listen to them if they came in late and want to hear it again, or they can listen to it if they want to share it with others. They can do that too, right?
Yeah, absolutely. Feel free to visit our YouTube page. Just look up Friends Committee on National Legislation on YouTube, or you can visit our Facebook page under the videos tab, and these videos are archived there, and so you can go back and watch 2 weeks ago's, and in 6 weeks from now, you'll be able to watch everything that's happened since.
Okay. I can see people have other questions. Jose, I don't know if you saw that someone has asked a question about death row in Texas, not a COVID related direct question, but clearly FCNL is opposed to the death penalty. I'm not sure whether we have anything specifically about states. Do you, anything about the conditions on Texas death Polinsky unit?
I can't say that I can speak to that. I know that there were, for the first time, some death penalty cases put on the calendar for the first time at the Department of Justice. That was really disheartening to see, but we do stand firmly against the death penalty.
Okay. Eric, our friend Eric Ginsberg in North Carolina asks about any efforts to coordinate between federal advocacy and state advocacy.
So in the coalitions where we sit, there are partners who do state advocacy as well. And some of the policies that we advocate for also affect individuals who are in the state prison systems. Like we advocated for and managed to pass the Second Chance Reauthorization Act, which was a grant program that gives nonprofits and other community-based organizations funding to help individuals coming out of state and federal prisons to re-enter.
Okay, final question. I just saw one from Lynn who's asking about this question that if people are released early, and then we have stories about people who are released early and committing crimes again, how common is that, and what do we say about that?
So I'm not sure how well, it unfortunately does happen because we know in terms of the figures of recidivism, we see an 83% recidivism rate, meaning you were rearrested within 9 years after release. So there are just conditions in our society that make for crime happening. And what we say is that you shouldn't be judged by the worst day of your life. And there are difficult conditions out there if you are someone who's coming out of prison. And sometimes you do end up committing another crime, or your circle has the criminal element. I think that we see space for redemption, and that's in all instances.
And I think there's some information I've seen is that the incidence of recidivism among people who are older is really quite low. When we're thinking about people who are over 50, over 60 being released, that the likelihood of those people having recidivist actions is pretty low. So I think we need to wrap up. We're at 4:30, and we're committed to making these 30 minutes long. I know that people have a lot of questions, and we really appreciate your involvement. We appreciate those of you who are able to continue to financially support FCNL. That's really vital to us right now. And we appreciate all of you who are willing to take action, to go to to send a note, or as Jim is encouraging people, to gather 2 or 3 people together and do a virtual lobby visit. I will say that it's my hope that one of the things that we might see and question is whether we really need to have as many people in prisons and jails as we have right now. And that we might recognize that this is not always the solution to addressing crime, that there are other means through which we as a society need to understand and address this behavior. Jose, any last words from you before we sign out?
I would recommend everyone to reach out to the members of Congress. The more they hear about this, the more the conditions grow better. There's a lot that we have left to do, and with their help, we can do it. Thank you.
Thank you, Jose. Thanks for joining me. And thanks to all of you who joined us by Facebook or YouTube or Zoom. And I look forward to seeing you again in 2 weeks.